Good afternoon, friends. I'm Dr. Aajay Shah, bringing this another afternoon live. Like I always say, I finish my lunch, healthy lunch, in 10-15 minutes and save time for this afternoon live. Today's topic is actually very important topic. Today's topic is about congestive heart failure. Congestive heart failure. We call it CHF, congestive heart failure. So what is congestive heart failure? Congestive heart failure is a condition where heart actually is not efficient to work as a pump. So again, heart is not efficient to work as a pump. That leads to poor cardiac output. That means heart is not pumping out enough blood to nourish the whole body, to send the blood out to every organ of the body. There are two types of heart failure. One is we call systolic heart failure. Other one is we call diastolic heart failure. Systolic heart failure means heart muscle is actually very weak. That means the pump itself has become weak. Diastolic heart failure means heart muscle actually has gotten very stiff. Heart muscle is not able to relax. So that's a diastolic heart failure. Systolic heart failure is actually much more dangerous and much more life-threatening. But both type of heart failure are very common. So what are the causes of systolic heart failure? Systolic heart failure is the one where heart muscle is weak. The most common cause in America for systolic heart failure is a heart attack. When a person develops heart blockage and heart attack happens, heart muscle gets lost, and that leads to the weakness of the heart muscle. Other causes include viral infection of the heart muscle. Sometimes drinking too much alcohol can weaken the heart muscle. Sometimes diabetes itself can cause the weakness of the heart muscle. Obesity or being overweight also is one of the reasons people develop systolic heart failure. And obviously people who have a long-standing high blood pressure and blood pressure is not controlled, they can also develop systolic heart failure or weakness of the heart muscle. The causes of diastolic heart failure, that means the heart muscle becoming stiff, include aging. As we get older, our heart muscle starts to get stiffer. High blood pressure leads to thickness of the heart muscle, we call LVH, and that can also lead to diastolic heart failure or the stiffness of the heart muscle. Diabetes also can cause diastolic heart failure, and sometimes when there is an inflammation of the covering of the heart, that can also cause diastolic heart failure. So what are the symptoms? How does a person feel when they are in heart failure? The most common symptom is shortness of breath or getting breathless when they are doing any activity. Sometimes this shortness of breath even can happen at rest, particularly at night. So again, shortness of breath is a very common symptom in people who have a heart failure. Other symptoms include development of leg swelling, where fluid is collected into the legs, also feeling fatigue and tired. And sometimes chest pain can happen also. There also could be abnormal collection of fluid in other parts of the body, including in the belly, and we call that ascites. So again, there are a lot of symptoms of heart failure. Obviously, you have to see your doctor to see if you have symptoms of heart failure and you have a heart failure or not. So what are the common tests we use for heart failure? The most common test to diagnose the heart failure is echocardiogram or an ultrasound of the heart. Ultrasound of the heart can look at the heart muscle, whether the muscle is weak or not. It can look at whether the heart muscle is stiff or not. It can also look at the heart valves. It can also look at the covering of the heart. So ultrasound of the heart or echocardiogram is the most common and most important test. So if your doctor recommends you have an ultrasound done, please make sure you get an ultrasound done. Very simple test. Non-invasive, it doesn't hurt anything, no IV, and it's very cost effective, and insurance covers it most of the time. The other test sometimes we use is a stress test to make sure there is no heart blockage, because heart blockage is one of the common reasons for heart failure. Sometimes we call cardiac catheterization, where we go through the groin or go through the wrist and look at the arteries of the heart and look at the fluid buildup in the lungs and in the heart. So sometimes your doctor may recommend to have catheterization also. So how do we treat heart failure? The best treatment is prevention, which we'll talk about it. So in terms of the diet, you have to follow low salt diet, low salt or no salt. In America, in general, we eat a lot of salt. People with heart failure should be eating no salt or minimum salt. In my opinion, no salt. So watch out for certain food, including a lot of soups, ready-made soups, including a lot of cheese, cheese and pizza, even bread, they all have significant amount of salt. Look at label in every food you eat to make sure there is not too much salt. Also at home when you cook without any salt. Also, following a whole food plant-based diet will also help with heart failure. If you're overweight or obese, getting down to the body mass index of 22 will also help the heart failure. Avoid also animal products. Many of the animal products actually have a lot of salt and a lot of saturated fat. So avoid animal products as much as possible. In terms of the medications, you may be prescribed medicine called beta blocker. Beta blocker is one of the common and very effective medicine for heart failure. Other medications include ACE inhibitor, we call it. Sometimes we use medicine called Entresto, which is one of the newer medicine. Sometimes we use diuretic or water pill. And sometimes we use one of the newest medication called SGLT2 inhibitor. So obviously your doctor will decide what medications you should be on. You may need to see a cardiologist. Make sure your cardiologist follows up with you on a regular basis. Regular sleep is very important. People who have heart failure, so make sure you sleep 7 to 8 hours if you have any heart failure. Regular exercise is also very important. As you come out of the heart failure with the help of medications, please start regular walking as much as you can on every day and build up to about 30 minutes of walking every day. There's enough data and there's enough proof that people who exercise regularly, they live long with heart failure. So make sure you take advantage of this benefit of regular exercise. Stress management is also very important. Managing stress will also help to treat the heart failure in a very effective way. Relationship and family, role of the family is also very important. People who have heart failure, having a good spouse, having a good life partner, having good family is very important. Whatever family eats typically is the way a heart failure many times gets treated. So if you have heart failure, your family member also will need to start learning how to eat no salt or low salt diet and also eating whole food plant-based diet. Definitely preventing and reversing obesity if you have. Obesity is one of the risk factors for heart failure, and people who have heart failure, if they lose weight and if they get down to body mass index of 22, their heart failure many times improves. So definitely, if you're overweight or obese, try to lose weight at least 1 to 2 pounds a week. Definitely avoid alcohol. Alcohol is a direct toxin to the heart muscle. So definitely avoid alcohol if you have heart failure. And if you want to have a drink, no more than one drink once or twice a month. So avoid alcohol as much as possible. Sometimes when the heart muscle is weak, particularly we call ejection fraction below 35%. Sometimes we may recommend putting a defibrillator. So talk to your cardiologist about it. Ejection fraction is the number which you all should be aware of it, where how much blood comes out of the heart. And normal ejection fraction is actually about 50 to 60%. If your ejection fraction is below 50%, that means you have a systolic heart failure. And if your ejection fraction is below 35%, your doctor may recommend to have a defibrillator placed. Obviously, this is a very complex disease, and you should stay in touch with your cardiologist and stay in touch with your primary care. So once again, heart failure, very common condition, very concerning condition. Prognosis with people with a heart failure, particularly systolic heart failure, is very, very grim. People with a heart function below 20% actually have a same kind of chance of dying as if people having a lung cancer. So best thing is to prevent the heart failure. Prevent the heart failure. So how can you prevent the heart failure? Treat your blood pressure. Control your blood pressure with medications, with losing weight, with lifestyle modification. So if you control the blood pressure, there will be less chance of heart failure. Definitely prevent diabetes. And if you have diabetes, try to reverse the diabetes and treat the diabetes effectively. Control your cholesterol so you don't develop heart blockage, and that can lead to heart attack and heart failure. If you have a heart blockage, definitely try to reverse the heart blockage with lifestyle changes and lifestyle modification. Definitely eat whole food, plant-based, no oil diet, and that will help you to prevent the heart failure. Definitely exercise regularly, sleep regularly, avoid alcohol to prevent the heart failure, and definitely avoid the obesity and being overweight. So again, this was a quick summary of heart failure. Heart failure is a very, very concerning condition. It should be prevented by all means. It's easy to prevent if you follow all the 6 pillars of healthy lifestyle and keep your body mass index below 22. I will be doing the short videos on a regular basis. We are growing on our Facebook page now, almost 85,000 followers. So please invite your friends and family to like our page. This video will be on YouTube in a few hours, so you can watch it again, watch it a few times. If you have friends with heart failure, pass this video to them and they will be able to watch it also. So again, thank you and have a great afternoon.